Hello, everyone. My name is Terry Gallagher. I'm the Director of Generalist Education, and I'll be talking to you today about our community outreach efforts in the college. So in addition to being the Director of Generalist Education, I'm also an assistant professor in the college and a family nurse practitioner. So I wanted to talk a little bit about my clinic that I started 5 years ago in 2015. It's called the Sujan Health Center at Oakley Square. And the purpose of this clinic is to increase access to primary care in a low-income community. This clinic is run through the Office of Faculty Practice, which is a department in the College of Nursing. This gives our faculty opportunities to practice their clinical skills in addition to serving our underserved communities. This picture on the left is me with the Assistant Dean of Faculty Practice, Angela Moss. You'll hear a little bit more about her later. And this picture on the right is me with a few teens from the Adolescent Empowerment Program that I started, as well as a GEM graduate, Serene Helwani, who's on the left, decked out all in rush gear. So Serene helped me to run the Adolescent Empowerment Program. It's to improve the decision-making of teenagers, and then also to educate them about their own health and also about the clinic itself. So when they need to come to the clinic, whether it's for immunizations or school physicals or STI testing or contraception, they are comfortable with myself and the rest of the staff and have no fear or shame asking for help. So we do lots of community outreach programs. We have a back-to-school fair where we do school physicals. We have students who volunteer at the clinic, and we also have students who work at the clinic too, as a part of a work study. So I want to talk to you today about RCSIP. RCSIP stands for Rush Community Services Initiatives Program. This is the program that most of our students volunteer through. There are tons of different programs we're going to get into, but the purpose of RCSIP is to educate the community, to be a resource for the community, to train and educate young people. We have a high school that's close to Rush called Crane High School. It is a medical preparatory high school. So their students are invited to Rush throughout the school year for different opportunities. During the summer, the students come to complete a health information management internship, and they also are educated about different healthcare professions. So why this is so important to us at Rush is because there is something called the death gap. This is something that was named by our former chief medical officer, David Ansel. He's written 2 books. One is about County, that's a hospital that's across the street from Rush. It used to be called Cook County Hospital. Now it is Stroger. It's a public hospital. And then his second book is The Death Gap, where it talks about the disparity in life expectancy in different parts of Chicago. So these are 2 books that I highly recommend that you read to understand the state of healthcare in Chicago, but also the wider United States. So because of the death gap, we started a program called Westside United. So as you can see here, there are different life expectancies that are listed on the screen here. So if you live in East Garfield Park, your life expectancy is 69. But if you live in the Loop, which is a wealthier area of Chicago, your life expectancy jumps up to 81. So in 5 miles in Chicago, the life expectancy drops from 81 to 69, which is what the life expectancy was in the 50s. So so if you just head west in Chicago for 5 miles, you essentially go back six decades. And a lot of this is due to racism and the way that Chicago is structured. Historically, Black neighborhoods in Chicago have not had the same opportunities as historically white neighborhoods. The air quality in Black neighborhoods is poorer than the air quality in white neighborhoods. There is not as much neighborhood investment. There is not as much access to health care. There are not reliable grocery stores and pharmacies, and all of this leads to a death gap. And so it's not enough for us to be, for Rush to be a hospital on the west side of Chicago. We also need to be good members of the community to address education, to address job opportunities, to address public transportation, and it takes the whole city to be able to do this. So Rush has partnered with different organizations that are listed here. So Malcolm X College is a partner of ours. The United Center, which is the Bulls and Blackhawks, they are partners. The Stroger Hospital, which I mentioned before, is a partner. Lurie Children's Hospital, Lawndale Christian Health Center, all of these are partners of Westside United to infuse resources to the west side of Chicago and to improve the overall health and wellness of the residents. So there are tons of opportunities for our students. Our students find the work that they do on the west side very gratifying, and most of them continue to stay involved after graduation. So here are a few examples of sites for RCSIP. So we have the Buddies initiative. So this is where if a child is coming in for a procedure or for a test, our students will read to the child to improve their literacy, because many chronically ill children tend to fall behind in school, and so we want to ensure that anytime children are spending at the hospital, they still are able to develop as expected, and also to improve their reading skills. There also is the Road Home program. That is a program for veterans who have PTSD. There are all different kinds of field trips and counseling sessions that are a part of the Road Home program. There is equine therapy that is very popular, and so if students are interested in that, they get trained in how to work with the horses, and then they help the veterans to participate in the equine therapy. We also have different clinics. So the Franciscan Outreach Clinic is one that I'm involved in. We'll talk a little more about that later. But that is a homeless shelter that's close to Rush, where students and providers will go there on Tuesday evenings, and it's all different kinds of students. So we have nursing students, medical students, physician assistant students, audiology, and pharmacy students, who all come together to provide care to those experiencing homelessness. The Chicago Recovery Alliance van, that is a mobile van where you go out to different areas of Chicago, again to address the needs of those who are experiencing homelessness. There is a clean needle exchange program as a part of that, and there also is wound care and education about STIs and STI testing. And then there also is the mini medical school. So that's where kids who are aged between 8 and 12 years old are invited to come to Rush for an intensive a medical school over the course of 2 weeks. So they learn different skills, learn how to use a reflex hammer, how to use a stethoscope. They learn compression-only CPR, as well as they also are exposed to different health professions to kind of engage them and to let them know what options are out there for them. And it's not just about being a physician or being a nurse. There are tons of different opportunities in healthcare, and these are children who might not have been exposed to these opportunities in the first place. As I mentioned before, with Westside United, it's very important to reach kids early, and also to educate them about all the different opportunities they will have if they stay in school and if they choose to go to college. So you can click on any of these links for more information about these programs. So in addition to our WICSIT programs, we also have a global health program. So Rush has 2 clinics. One is located in the Dominican Republic, and the other one is located in Haiti. So the clinic in the Dominican Republic has been around for a little bit longer and is well established. The clinic in Haiti is just a few years old, and so there are still lots of changes going on there. But students are able to participate in these global health trips. There are about 6 trips a year to each clinic. So there are 3 trips that are medical trips only, and then there are 3 trips that are surgical trips. So we have ENT surgeons, we have gyne-onc surgeons, and orthopedic surgeons who will travel to these communities to provide care. As you can see, there is a cost that is associated with these programs, but usually our students are able to apply for scholarships through the Global Health Program, and most are able to go with the trip either is free or a small cost. So I want to talk a little bit about our COVID-19 response in the College of Nursing. So nurses have been crucial to addressing COVID-19. I can speak for Rush and across our whole system. Nurses have been redeployed all over Chicago based on need. One huge thing is our testing teams. So we have testing teams at Rush that are here every day, but then we also have testing teams that are going out in the community. We had to increase our ICU beds, and so lots of nurses who previously had not worked in the ICU were redeployed to the ICU. Telehealth has been very important. We have RNs and nurse practitioners who are doing telehealth to address needs of the community. We also have nurses who are delivering groceries to people who are delivering people's medications to them, are delivering masks to the community, are making masks, and then also are educating people about COVID-19 itself. So in the College of Nursing, as I mentioned before, the Office of Faculty Practice, we got involved very early with different providers around Chicago to address the needs of the homeless during the COVID-19 pandemic. It started out as just a daily conference call with a handful of providers to try to stop the spread of COVID-19 in the homeless shelters across Chicago. This turned into a citywide response to homelessness. So I'm going to get out of this screen here and show you our charge white paper. So the charge report stands for Chicago Homelessness and Equity. Chicago Homelessness and Health Response Group for Equity. So this is, you also have a link to this, but it basically outlines what our group has done to address homelessness in Chicago. And here are a few of our students who are going out and doing testing. Here is the Franciscan Outreach Homeless Shelter, which is what started this whole thing because when the COVID-19 pandemic reached the U.S., we were supposed to be in our Tuesday night clinic, and we did not feel like we had adequate PPE there, so we could not invite our students to come there and provide care. And the conference call that we started to brainstorm about our Tuesday night clinic turned into this charge group. So in addition to that, to the charge group, nurses from the College of Nursing created the only isolation facility in all of Chicago. So there were supposed to be a couple of isolation facilities. Ours opened first, and once ours was opened, it was decided by the city of Chicago that the other ones did not need to be opened. So first, we were the only isolation facility for the state of Chicago. We also are the only isolation facility for Cook County, and then we also just signed a partnership with Kane County too. So anyone who is COVID positive, but does not need to be admitted to the hospital, but needs a place to isolate, will come and stay with us. So we were featured in the Washington Post. So I'm going to try to play this for you right now. So give me one moment, and we'll see if this works.
Shelter for COVID positive individuals who need a safe place to recuperate from COVID. And we know that in the homeless population, it's disproportionately African American and Latinx populations.
Hi, how you doing?
We're going straight through to the
As healthcare providers and healthcare institutions across the country, there needs to be a strategic effort to reach out and address health disparities in the country, because just sitting back and waiting for people to come to us so that we have the privilege of addressing health disparities is not going to happen.
The thing about the crisis that has become abundantly clear to myself and colleagues is that this crisis already existed, the housing crisis, the racial inequities in healthcare, and so on. And so coronavirus just has magnified those problems. From an advocacy standpoint, it's bringing a lot of these problems out to light so that we can actually fix them. I really think that we cannot go back to how we were addressing these issues before coronavirus, because it's just exposed so many problems with the healthcare system, with the housing system, and so on. This is a homeless shelter for COVID positive individuals who need a safe place to recuperate from COVID. And we know that in the homeless population, it's disproportionately African American and Latinx populations.
Hi, how you doing?
We're going straight through to the
As healthcare providers and healthcare institutions across the country, there needs to be a strategic effort to reach out and address health disparities in the country, because just sitting back and waiting for people to come to us so that we have the privilege of addressing health disparities is not going to happen.
The thing about the crisis that has become abundantly clear to myself and colleagues is that this crisis already existed, the housing crisis, the racial inequities in healthcare, and so on. And so coronavirus just has magnified those problems. From an advocacy standpoint, it's bringing a lot of these problems out to light so that we can actually fix them. I really think that we cannot go back to how we were addressing these issues before coronavirus, because it's just exposed so many problems with the healthcare system, with the housing system, and so on.
So at every step along the way of our COVID-19 response, we also have had students. So here's an article that was written about our students who previously were volunteering at the homeless shelter at the clinic, who then went out to various homeless shelters all around Chicago to test people for COVID-19 and then help them to isolate or to quarantine, depending on their need. And then once people were screened positive and sent to our isolation facility, this group had also made these kits to help them to feel better. So it had personal hygiene products in it, Tylenol for their fever and body aches, and just other things to cheer them up. So I want all of you as prospective students to know that anytime your faculty at Rush are taking a part in anything, we always are including students in our process, because, as we say, we are training our future colleagues. So we might as well start to work together now. So to get back to our PowerPoint, if you are interested in volunteering and getting involved with RCSIP, it is run by Dr. Sharon Gates. Here is her contact information here. You can feel free to reach out to her for more information. If you're interested in anything that we're doing at the college with regards to the community or COVID-19, feel free to reach out to me. And I wish you all the best, and I hope to see you all soon. Have a great day.